Resonance disorders occur due to an imbalance of the resonance of the voice as it passes through any of the resonating cavities. So there could be a problem at the level of the larynx, the pharynx, between the pharynx and the nasal cavity, between the pharynx and the oral cavity, within the oral cavity, or within the nasal cavity. There are multiple causes for resonance disorders. It can be related to the neuromotor signals, so a problem with the peripheral or central nervous system, or it could be a physiological disorder where we have tumors or other growths within the structures causing poor movement, or opening and closing of that velopharyngeal mechanism, or just the ability to vibrate the pharyngeal, laryngeal, or oral cavities. So some of the causes could include dysarthria, and we'll talk about dysarthria in a future lecture. It could be dystonia, where we have poor or weak muscles. It could be a neurological disorder occurring in the central or peripheral nervous system. Apraxia, which we'll also talk about in a future lecture. It could be related to a tumor in any of the resonating structures, or enlarged tonsils or adenoids. There are different characteristics to abnormal resonance, and it'll all go back to thinking about our resonatory cavities as a system of pipes. So if we look up here in the corner, what we're going to talk about really is the oral resonance. So during oral resonance, we have to have good closure of the velopharyngeal port and a good set of structures in the larynx, the pharynx, and the oral cavity so that all of the structures can nicely bounce around and resonate that sound as it passes through. Now, something can happen where we have too much leakage through the nasal cavity or into the nasal cavity because of a problem with that velopharyngeal port. So hypernasality occurs when we have too much sound resonating in the nasal cavity, and it's most perceptible on vowels or voiced phonemes. So those are the ones where the vocal folds vibrate to produce sound. That could be something like, "Since he sees the sun in the sky," where we have too much sound resonating in the nasal cavity. On the flip side of that, we could have nasal air emission, and that's when air pressure is leaked into the nasal cavity. And think about how sound is created. Sound is due to air flowing through the vocal cords. So naturally, that sound is produced as the vocal folds vibrate, but it's also carried through air. So hypernasality and nasal air emissions are not exclusive definitions. We can have both of them occurring together, but it's more perceptible to have hypernasality on our voiced phonemes because that sound is leaking through a very large hole in that velopharyngeal port. With nasal air emission, it's mostly or more perceptible on voiceless phonemes because we have more air being pushed through that velopharyngeal port. But again, we have air going through the velopharyngeal port with sound or voiced phonemes and with voiceless phonemes. When we think about the specific types of phonemes that are going to give us more problem or give us more perception of nasal air emissions, it's going to be on plosives, and that sounds like p and b. Fricatives like s or z, or affricates like ch and j. And that's because we're putting more pressure on that velopharyngeal port, more pressure on those muscles, and so if there's any type of weakness or area for leakage to happen, it's going to happen on those high pressure sounds. On the flip side of that, we have abnormal resonance where we can have a clogged pipe, and this is mostly on nasal sounds, so it's insufficient nasal resonance. It's more perceptible on nasal sounds because the sound is supposed to go into the nasal cavity, but it can also be perceptible on oral sounds. So we think about our normal mechanism. We have the velopharyngeal port opening, allowing the sound to travel into the nasal cavity and resonate in the nasal cavity. But if there's any type of blockage on this velopharyngeal port, we can have a backflow of that sound where it's not coming through enough into the nasal cavity, and so it can sound a little bit stuffy. So it might sound like "Mama made lemon jam" instead of "Mama made lemon jam." There is one cause of abnormal resonance that we're really going to focus on, and that's velopharyngeal inadequacy. Velopharyngeal inadequacy, or VPI, is a resonance disorder that occurs when the VPI, or the velopharyngeal port, doesn't function adequately to and prevents the transmission of sound into the nasal cavity. So it can occur with or without a history of cleft palate. We're going to focus on cleft palate in this course, but just know that it doesn't have to be just that. Now there are two subtypes of VPI. So when I say VPI, I'm going to refer to velopharyngeal inadequacy, which is just a generic term that includes any type of abnormal function of the velopharyngeal port, regardless of the cause. The two types are velopharyngeal incompetence, which is related to a neuromotor or physiological disorder that results in the poor movement of the velopharyngeal structures. So that means that we have incompetent structures, but all of the structures are there. They are present, they're just not doing a very good job, so they're incompetent workers. And the causes for that could be dysarthria, dystonia, anything related to neurology. It can also be a hearing impairment where we have poor feedback in our auditory loop, or a result of chemotherapy that our structures are there, but they're not getting enough signal to open and close the velopharyngeal port at the appropriate times. Then we have velopharyngeal insufficiency, which means that we have insufficient anatomical structures, and it's a defect in that structures that prevents adequate velopharyngeal closure by causing the velum to be too short relative to the posterior pharyngeal wall. So it creates a gap so that we don't have that complete squeeze in the velopharyngeal port to seal off the nasal cavity, and air or sound can leak through. So that's where we're really going to focus on our cleft palate population, but it can also be related to a tumor or a surgery to the soft palate, or a surgery to the hard palate.